Hi, everyone, and good afternoon. Thank you so much for the introduction. Welcome to our first ever U.S. Embassy Alumni Public Health Interest Group meeting. Thank you all so much for taking the time out of your day to be here with us. We're honored to see all of you virtually gathered here today. My name is Elizabeth Smith, and I am a public diplomacy officer here in Islamabad at the U.S. Embassy. I'll be working with my other colleagues in public affairs and in other sections of our embassy throughout the country to establish and support this interest group for U.S. government program alumni, specifically on public health issues. Just wanted to raise some housekeeping norms from the beginning. So if you could kindly please keep your mics muted when you're not speaking, but you're more than welcome to keep your video on, and that's completely up to your preference. Today is our first meeting, and we're kicking it off with introductions and establishing a purpose. I first would like to give you a little overview of what you can expect over the next hour. And at any time, feel free, I see some folks that are already using the chat. Please feel free to ask questions or raise anything throughout the chat throughout. So with us here today in addition to my colleagues serving at the U.S. mission here in Pakistan, are all of you, these esteemed participants who are experts in the fields of medicine, public health, and policy making. We're grateful for your interest and time in being here with us today. So, what can we expect from today's meeting? Well, first, let's all get to know one another. I will now ask my other U.S. government colleagues to introduce themselves to you and their position or their role at the embassy or consulates. Then I would like to invite all of you, our invited guests, to introduce yourselves. Additionally, we will talk about the purpose of this interest group and really just spend some time getting an idea of what each of you would like to get from this group. Finally, we'll also have some time today to hear a little bit about the work and perspective from my colleagues who are serving in the CDC and USAID today. So let's start with my colleague introductions. I'm going to pass it over to you, Shahid.
Yeah, thank you, Elizabeth. Thank you, everyone. This is Shahid Wasim. I'm working as Country Alumni Coordinator along with Usman, Elizabeth, Lisa, and other colleagues from USCP. So we are looking forward for your participation in future. So thank you, everyone, for joining.
If my other U.S. colleagues just want to unmute themselves and introduce, we have several here from the embassy or the consulates. Feel free to just kind of popcorn style introduce yourself.
Sure. Thank you very much, Elizabeth. Good afternoon, everyone. This is Usman Sadiq from U.S. Embassy. I work with Shahid Wasim Saab as Deputy Country Alumni Coordinator. I welcome you all to this group, and thank you all for taking time to join this meeting. Looking forward to hear your ideas and the work you do in this field. Thank you very much.
Hello, everyone. This is Hamza Lakhani from U.S. Consulate General Karachi. I work with my colleagues in Embassy Islamabad and at the consulate. So I welcome you all here and looking forward to hear your ideas and suggestions. Thank you.
Hello, everybody. This is Dr. Kamran Ajaib. I'm working as a Senior Technical Advisor for the Health Office of USAID, and I welcome you all on behalf of our team. Thank you very much.
Hi, everyone. I'm Philip. Oh. Go ahead, Philip.
Okay, nice to see you all. Nice to meet you. I'm Philip Assis, the Deputy Cultural Attaché at the U.S. Embassy in Islamabad. And I work with all the colleagues from the embassy and consulates here. Very pleased to meet you. Thank you.
It's me, Dr. Shabir Chandra. I'm the Senior Health Advisor with USAID Mission based in Karachi. Over.
Hi, good afternoon, everyone. This is Dr. Ismail Baik. I'm Health Advisor with USAID based in Punjab, Lahore.
Hello. Hi, good afternoon, everyone. My name is Mike Berenson, and I work in the economics section here at U.S. Embassy Islamabad, and I cover environment, science, technology, and health. Over.
And I'm Dr. Christy Reed. I'm the Centers for Disease Control Country Director here in Pakistan. Been in country since October, but working with Pakistan since a year ago now, since April 2020. Welcome to all of you, and we look forward to hearing from you.
Okay, was that all of my colleagues? Anyone else?
Yeah, hi, that's me. Hi, everyone. This is Anam. I work with Mike in the economic section of the U.S. Embassy Islamabad. I work on issues related to health, environment, science, and technology. I'm very excited to be part of this group and looking forward to a very good discussion ahead. Thank you.
I'm Shanila Mazhar, Communications Officer, PUAN USCFP, which is the largest alumni network on the face of this earth. And I'm so proud to be part of this. Thank you.
All right, I think we have, that might be all of my colleagues. If not, feel free to introduce yourselves when we introduce the participants. Great, thank you all so much, colleagues, for spending this hour with us today. And we hope that through this, we'll be making some connections with our alumni professionals who are working in the public health sector, and that it'll be beneficial for all of us. Now, we would like to take the opportunity to have each participant introduce themselves for about a minute or two each. Please feel free to tell us your name, the exchange program, and the year that you attended, your current position and organization, and perhaps a reason or the hope that you hope to have by, you agree to join this interest group. So if you want to tell us a little bit more about your hopes or reasons why you joined. I'll put all of that in the chat too, so that you can remember what I said, but your name, organization, your title, the year of the program that you went on, and your purpose for joining. And it's just popcorn style, so feel free to unmute yourself and introduce whenever you're ready. Over to you all.
Hi, this is Dr. Sobia Faisal. I am a Fulbright alumni, right now working as a technical consultant to CDC Pakistan, based in Islamabad. And my expectations from this group are I want to learn from the experience of my fellow colleagues, and that's a great platform for that. Thank you so much.
Hi, good afternoon. Dr. Faisal Abbas here. I am Associate Professor at NAST. I got the Fulbright postdoctoral research, visiting research fellowship. I went to Cornell University in 2016. And currently I'm Associate Professor at Department of Economics, NAST Islamabad. So my research area is basically talking about child health, gender, violence, impact of income and remittances on child health and women health. So that's why I'm part of this group. Thank you.
Hello, I'm Dr. Arjuman Faisal, working in area of public health since last 4 decades. I went to East-West Center, Hawaii, and through the open grants and did my master's in public health there. I did membership and fellowship degrees in public health from Pakistan. I have worked in Pakistan and internationally. I was with WHO as an international staff member. And in Pakistan, I was with USAID for 4 years from 1989 to 1993, when the largest program, Child Survival Project, was launched, $62 million project. It was the largest, second largest in the world. And I was the program management specialist. At that time, we initiated many programs. For example, the LHW program. It is we who showed to the government, after experimenting it for 1 year in Haripur, what can we do by introducing these health workers. So I carry a lot of history of the Pakistani programs and a lot of programs that USAID did that are still functioning, what ups and downs they have gone through. And have been part of several committees, have led more than 50, have been the team leader for more than 50 researchers for World Bank, ADB, other DFID and other funding agencies. And I work now as an independent consultant. I had the firm called Arjuman and Associates, through which we did all those research work. But now I work as an independent consultant only on those things that appeals to me. The rest of my time is spent in promoting arts in Pakistan. I joined this group because I thought I may be able to give the background to the group of several things, what was successful and what was failure and why things work in Pakistan and why things don't work. So that was the idea. And also being part of USAID, I could share my experiences with the people that what were the basic, philosophies of launching those programs, which have changed so much over the years by different people because they lost the vision that why it was established. Thank you.
Assalamu alaikum. I'm Mohammad Usman Zahir. I went to the US on Fulbright PhD program in 2014, and I was there for 5 years, and I did my PhD in epidemiology there. Here in Pakistan, I currently work with a US-based organization, Health Security Partners. In Pakistan, we are working with DAI Pakistan and other consortium partners from UK as well as from Pakistan, including Alumni University, for combating antimicrobial resistance and antimicrobial use with a One Health approach, catering to the needs of animal health, human health, and the environmental health. By basic training, I am a veterinarian, and I'm also board certified in veterinary preventive medicine from the American College of Veterinary Preventive Medicine. And the reason for joining this group is that I believe that the problems that we are currently facing are the ones which cannot be dealt by only one discipline. We really need an integrated and a collaborative approach where we bring in experts from other disciplines as well, including disciplines like medical sciences, veterinary medicine, agricultural scientists, economics, and other disciplines which could assist us in solving the problems that we currently face, including the pandemics, like we are facing this coronavirus pandemic, which have its roots in the animal health side. We see that happening, and also considering the fact that with the urbanization and growing global population, we are encroaching into the wildlife habitats, which expose us people because of our own anthropogenic activities to those viruses which have been living there for years in a very balanced system. But since now we encroach them, we are disturbing the ecosystem. So with all that in mind, I joined this group so that I can also bring in the perspective of veterinary preventive medicine to the group so that we can move towards a better solution to these problems. Over, thank you.
Hello. Hello, this is Saman Nazir.
Saman, you were introducing yourself and then you were muted. Can you try again?
Hello. Can you hear me now?
Yeah, now we can. Thanks. Go ahead.
Okay. I'm Dr. Saman Nazir, and I was part of the Fulbright Foreign Student Program in 2015-16. And I went to US for doing my PhD in sociology. So I'm a medical sociologist by qualification. And right now I'm working in Pakistan Institute of Development Economics as a senior research economist. And we work directly with the Planning Commission of Pakistan. And the research I do is mostly on the health sector and public health. So this group is like, I'm here to really glad to join this group because I want to learn from all other people who are working in the public health and yeah, and health management. Yeah, thank you.
Hello. Am I audible?
Yeah, go ahead.
My name is Umar Dil, and I have been working in the social sector from the last 15 years. And I have been worked with Pakistan Christian Society, International Organization for Migration, World Health Organization, UNHCR, UNICEF, and the Provincial Disaster Management Authority. And currently I'm working as a District Health Communication Officer with UNICEF-funded communication network in the polio program. And I remained an Atlas Corp Fellow from 2016 to 2017 in Washington, D.C. And the reason I have joined this group is that I want to share my experience with other colleagues, and I want to learn from their experiences. And as I am completing my MPH degree in the coming 2 to 3 months, so that's why I consider that this is the right platform for me to share my experience and learn from other colleagues. Thank you.
Hi, can I take the next one, please?
Go for it.
Yeah, hi, sorry, I'm masked because I'm physically at the hospital right now. And being essential services, we have people walk in and walk out all the time. So I need to be masked all the time. My name is Azra Maqsood. I am not a doctor. I'm a healthcare worker in the my first degree in business and my second degree in management sciences. But currently I work in the capacity of a chief operating officer for Pakistan's largest public sector cardiac facility. And we cater to almost, even in the times of COVID last year, we had almost 1.5 million patients benefiting out of the National Institute of Cardiovascular Diseases, because we are a totally free hospital. We are not subsidized, we are totally free in terms of all cardiac services, all cardiac facilities, all medicines, from A to Z, we're totally free. And the reason I was interested in being a part of, one, I'm an alumni of the Pakistan-U.S. exchange program from the year 2015. That was the time I was very involved with small and medium enterprises, especially on women's entrepreneurship. So that's the reason I was a part of that program, and that program was titled Education, Employment, and Entrepreneurship. And when I came back from the IVLP, it was the International Visitors Leadership Program. When I came back, it was lucky. The program was lucky for me because I got a break to be working and serving for Pakistan's largest cardiac hospital here. The reason I thought I could add value and obviously learn from all the other colleagues here is because the NICVT over the last 3 years has expanded overall the province of Sindh. And apart from setting up physical hospitals everywhere, setting up cath labs, this is where you take a patient in at times of heart attack. We've got this novel idea of converting containers into what is known as a cardiac emergency facility. So we have 21 what we call CPUs, chest pain units now. And a person driving at a distance of 90 minutes can touch one of the CPUs. And if that person is identified in the triage as having a major heart complication, the patient is put into an ambulance and brought back to the main facility or to anywhere that is close by. So that's the reason, because we've been doing so much of community work, even with COVID. As I speak to you right now, we have 55 COVID patients up there who are being treated for cardiac ailments. So I thought this is where I could contribute with the expanse of NICVT in the last 3 years all over Sindh, and the penetration into public with free medical services. That's all from my side.
Okay, hello everyone and Assalamu alaikum. This is Dr. Khadija Siddiq. I'm quite young as compared to a lot of other people who are quite much experienced, mashallah. I'm a graduate of Dow Medical College, and I'm alumni of the Study of United States Institutes program as a Pakistani young leader in 2015. I was in my second year of graduation when I went there. Currently, I am a fresh graduate. So basically, currently I'm working as a medical officer in the Field Isolation Center, Karachi, Expo. My reason for joining this particular group is that since the very beginning of my graduation and the day I started working in a tertiary care hospital, the civil hospital situated in Karachi, affiliated with Dow Medical College, I realized one thing, which was that our health setup is not is more based on treating the symptoms. It is not based on how to prevent certain diseases, or you may say many diseases. So basically, since day one, I decided to opt a career in the public health. Recently, I am trying to get a scholarship, Fulbright scholarship in US for the MPH program, and this is my major interest, to learn more about this field and to know that how can I play a major role by doing a master's in MPH in Pakistan, and to create better and to give out better ideas and to change the paradigms of this field towards how can we prevent diseases as compared to giving more and more pressure on the hospital setups and the patient and doctor relationship. That's it from my side. Looking forward to listen to other people. Thank you so much.
Okay, can I take this? Hello. Hello, can you hear me? Assalamu alaikum and good afternoon. I'm Rakshanda, as you can see my name. And I attended the Legislative Fellowship Program in 2012. It was then second in the row, and only 4 professionals were selected from Pakistan. What am I doing? I've done a lot of things. This is my 3rd decade in social development industry. And I won't go into the details, but I have diverse and matching interests, and gender has remained the common denominator of all areas of my work. I have done some pioneering things related to gender and women empowerment in Pakistan. I won't go into these details, but what I like to share with this very interesting group is that many of my mentees and students have been part of PUAN. They have attained Fulbright scholarship, Humphrey fellowships, and a lot of other, exchange programs. So I'm very excited to be a part of this group, and why I am particularly interested is the fact that the 3 areas of my current interest are ageism and issues of women and girls with physical disabilities and mental health, and how these can be promoted in dialogues that are happening at policy levels, and those who are working more closely with those stakeholders and relevant people in the government and institutions that can influence government. These voices and many unheard perspectives can be taken to the power tables. And for that reason, I have also initiated some of my social entrepreneurship ventures. I'm also one of the former social entrepreneurs from Pakistan, being in Ashoka furlough, literally in last century, 20th century. So Apna wallet, as you can see in the background, Apna is an Urdu word, and wallet, we know what is it. So it is for financial and behavioral health of all women, including trans women. So these are some of the ideas and objectives that brought me here. I'm thankful to PUAN and US Embassy for creating this platform and inviting me. And I'm very excited to see a lot of young people who are leaders and who are going to be very inspiring in future, and some older colleagues. Thank you.
Hello, everyone. My name is Farida Khan. I went to US on Humphrey Fellowship in the year 2018. Currently, I'm working as a principal Islamabad Nursing College of Islamabad Medical and Dental College at Islamabad. My purpose of joining this group is I wanted to explore different strategies and different techniques that as a group we can implement in Pakistan to improve the quality of healthcare. Thank you so much.
Great. Are there a few others that will introduce themselves?
I'll go next.
May I go next, or any other is there?
Go for it.
Okay, Dr. Sumaira here. Basically, I'm belonging from the tribal belt northern areas from Kipi, and I'm the parliamentarian representative of public at the Provincial Assembly of Khyber Pakhtunkhwa. And I have been to the exchange program in 2019 with the IBLP on foreign and women security issues and affairs. I have been the chair for Standing Committee on Health for about 2 years. Currently, I'm serving as our chairperson, Women Parliamentary Caucus. And beside this, I have contribution to the health sector and have expertise to work on maternal and child health from the public health perspective. I'm also leading the initiative school-based deworming program, which is being funded by the Evidence Action, a US-based organization. And beside this, I'm also working on mental health and other issues. And currently, I have been affiliated with the MSF on misuse of oxytocin and labor-inducing drugs. It's a study being in process over the over-counter availability of misuse of labor drugs. And beside this, I have the privilege that I am the youngest parliamentarian at the Khyber Pakhtunkhwa Assembly in the history. And I was graduated by 2016 from the Khyber Medical University. Thank you.
I believe there was someone else that was going to introduce themselves, or anyone else who hasn't yet already.
Can I go? All right. Assalamu alaikum, everyone. My name is Usama Javed Mirza. I began as a physicist and then jumped into emergency medical care. I am a New York State licensed emergency medical technician. I went on my Fulbright Master's in Education from 2015 to 2017 from Columbia University. And since 2017, I've been back in Pakistan, and I've launched an organization called Saving 9, which is it's a social enterprise, and it's dedicated to teaching people how to save lives by imparting first aid and mental health education across Pakistan. I'm sending some details here on the collective chat. Some of our initiatives include, for example, launching Pakistan's first women-led and run ambulance. And nowadays we're working on launching the world's second and Asia's first mental health ambulance within main Islamabad. And we're actually working with support from the United States Institute of Peace to do a nationwide digital advocacy campaign on public health awareness and supportive policies for public schools within Pakistan, targeting middle school and high school, where we know because of COVID, there's a lot of anxiety and a lot of mental health challenges. We are going to do a whole campaign in order to lobby with policy professionals, bureaucrats, activists, so on and so forth, to get the government to really create supportive policies for these students. And we're also working in partnership, hopefully, with the KPK, Islamabad, and Punjab governments to create model mental health inclusive schools, 100 of them across Pakistan. I'm looking forward to connecting with all of you.
I think there might be a few more people who haven't introduced themselves.
Yeah, can I go?
Please, go for it.
Hi, good afternoon, ladies and gentlemen. This is me, Asya Ashraf, and I'm a Humphrey alumna, 2015-16 from Virginia Commonwealth University. And I am serving in the field of drug addiction treatment, rehabilitation, policy and prevention from last 18 years. Currently, I am serving as a mental health specialist and addiction specialist at IMR Institute of Medical Rehabilitation, and also working on creating own facility with the name of PSIN, which is House of Peace and Tranquility for Substance Use and Mental Health Disorders. I'm national trainer for UNODC, and I am basically working for more humane, gender-sensitive treatment policies in the national and international arena in the field of drug addiction and mental health disorders. So it would be good to be with you all. Thank you.
Now may I?
Please.
Hi, this is Amir Shah from Karachi Vocational Training Center. I was fortunate enough to be part of IVLP program in 2013 back, disability rights and issues. So right now I'm from Karachi. It's a Karachi Vocational Training Center for intellectually challenged kids, and it's a rehab center. Basically, I've been working here since 1993. It's been 28, 29 years. So I'm glad to be part of this group because I'm associated with mental health. We have over 2,000 kids on job right now. So it's really an honor for me to be part of this group so I can learn and I can share my experience. Thank you.
Is that everyone? Is there anyone else who would like to introduce themselves? If so, please go ahead.
I guess we are left with Dr. Zaim only.
Yes, hi. I'm sorry, I was actually running around. My name is Dr. Zaim, and I work as a District Health Officer, Executive Health Authority, Islamabad. I've been working on COVID-19 from the beginning of the pandemic in the federal capital. And also that I graduated from US on Fulbright grant from University of Oklahoma and Johns Hopkins University. Currently, I'm looking after the entire vaccination processes, streamlining and getting everybody vaccinated, trying to control pandemic through different scientific means of surveillance. And that's it for now.
Great, thank you all so very much. I appreciate those introductions. It's an honor to be meeting and working with all of you. It's a very intimidating and impressive group. And we're really grateful for your public service and all the amazing contributions you make to society. I believe, Shanila, you wanted to do the photo now for social media, and then we'll continue on to our program with the CDC and USAID. Is that correct? So if you're willing to be a part of the program, the photo, if you could just real quick, show your video real quick. We'll do a low group photo as a gallery. And then if you prefer, then you can take off the video when we're done. Shanila, do you want to over to you to guide us through this?
Yep, let's wait for another like 5 seconds or so because I can still see 13 non-video participants. I can still see 2 people who are trying to turn on their cameras. Okay, Anam, we can't see you. I guess there is some issue on your side. Okay, so I guess maximum people have turned on their cameras. So on the count of 3, 3, 2, 1. Perfect. Let's take another one because I wasn't able to capture Omar Dil in the previous one. On the count of 3, 1, 2, 3. Perfect. Thank you so much. Over to you, our moderator. Thank you, everyone.
Great, thank you so much. I really appreciate that. And now we have a little bit further introductions for you all. I know that you introduced all of your organizations. We wanted to introduce a little bit about the public health work that we do here as part of the US government in Pakistan. So next, I would like to introduce you to a very relevant speaker, our colleague and the director of the Center for Disease and Control in Pakistan, Dr. Christy Reed. Over to you, Dr. Reed.
Thank you, Elizabeth. I'm delighted to be here. And as noted, I'm Dr. Christy Reed, the Centers for Disease Control Pakistan Country Office Director. For those who might not be familiar with the CDC, the mission is the national public health entity for the United States, equivalent of many countries of National Public Health Institute. And the mission is to detect, prevent, and protect the American population from diseases that are preventable. And the focus currently and its origins are in infectious diseases. If during the 1940s in the United States, a lot of the pilots for World War II were being trained in the South and being affected by malaria. When they were sick, they couldn't be trained. So there was efforts to control malaria, which at that point in time could extend as far up as even Philadelphia, with in the past has the conditions for things like even yellow fever. Yellow fever was not happening, but malaria. And efforts to control malaria were successful. And it was a benefit of that experience that lesson learned that malaria could be eliminated. They continued on after the emergency. And that was the origins of the Centers for Disease Control and why it's located in Atlanta, Georgia. And over the years, it's expanded from infectious diseases to any kind of preventable disease, whether that's environmental, accident, injury, non-communicable diseases. So there's been a relationship with countries such as Pakistan over the course of the years. The relationship specifically with Pakistan dates back to the 1980s with the goal of polio eradication as part of the Global Polio Eradication Initiative, GPEI. And subsequently, there were individual interactions on perhaps individual infectious diseases, and most recently in influenza, in setting up surveillance systems as part of the global surveillance system to better understand and predict patterns of influenza. That's been for over a decade. Around 2006, another initiative started, which many of you may have heard of, the Field Epidemiology and Training Program. And that was an initiative that was based on a training program called EIS of the CDC. And in the last now 15 years, the program has reached international accreditation and is in the process of transitioning fully to the government. It has been part of the NIH, but as of the end of this year, will become fully part of the Ministry of Health, which is an incredible success story. And Pakistan is the third country after Thailand and Kenya where that program has made that transition. Now, with the advent of SARS back in 2004, the discussions over the course of events about what would an international pandemic look like became reality. And the world focused on prevention, detection, and control of potential future pandemics. So there were various initiatives, global disease detection, and more recently, the Global Health Security Agenda. The reason being that what affects any of us affects all of us. The Global Health Security Agenda focuses on several pillars. For example, increasing the ability to detect through surveillance systems and also through laboratory practices, but also the ability to analyze the data, for example, along the lines of FELTP in terms of responding to situations, analyzing the factors and determining what might best be suited to intervene and interrupt transmission. So we would say prevention, detection, laboratory and surveillance, intervention in terms of emergency operations center. So the various parties that are involved in responding are coordinating on a regular basis. So they have a smooth system, and when an emergency happens, then they increase the level, but that background level of communication that makes things happen more expediently is there. And then in particular, another aspect, and I think that was touched on by the individual who mentioned One Health, is the One Health aspect of there's a focus on human disease. CDC focuses primarily on human, but we recognize the intersection with the animal and veterinary, particularly in the area of antimicrobial resistance. Antibiotics are a wonderful thing and changed the course of events in the mid-1900s, but they've also become a dynamic with the organisms, that the organisms are developing resistance. If we were to lose the capacity, if the organisms all became resistant, it would return us to the previous situation when we had no antibiotics. So in anticipation and trying to prevent that, efforts to reduce the practices that lead to resistance, being conservative in terms of the appropriate use, and also other strategies, but also understanding the dynamics, because epidemiology is at the center of what the Centers for Disease Control does, which is the study, distribution and dynamics of diseases and populations. So in 2015, Pakistan was one of the first countries in which this partnership for the global health security agenda was developed, and the CDC opened an office here with a previous director, so I'm the second director, and working with the partners in country on these various pillars that we just described. And it's an international movement, and actually Pakistan right now is on the Secretariat, and there are meetings driven by the ministries each year, and there with WHO, there's a whole ranking system in terms of helping countries see where they are on the ladder to meeting all of the elements, and that's called the Joint External Evaluation. So our program here in Pakistan focuses on those pillars of the global health security agenda of laboratory, surveillance, emergency operations, and these are broad topics that we could spend a whole hour discussing. Examples of antimicrobial resistance, and then another cross-cutting of infection prevention and control. Again, it's a prevention effort, but it's also aimed at preventing for healthcare workers who are so important to the response. So we work with local partners on these, and there are also individual efforts of various subject matter experts in Atlanta on particular individual diseases. For example, Crimean Congo hemorrhagic fever is another example. So that is an overarching concept of the work that the CDC does to support the government of Pakistan's efforts in its national health and ministry, and primarily with the National Institute of Health. And I'm going to cede my last few minutes to our colleague, Dr. Sobia Faisal, who you heard earlier has introduced herself, who is a consultant, a local consultant to CDC Pakistan, and has a range of experience of having worked in Pakistan, having trained in the States, having worked back in Pakistan in public health, and now working in support of the CDC and the mission with the government to enhance global health security agenda. So I will turn it over to her for, I think, what you'll find is an interesting perspective. And we look forward to hearing from all of you about your thoughts on the way forward in the arena of public health and prevention in Pakistan. Dr. Sobia?
Yes, thank you, Dr. Reed, for giving me time and opportunity to present my perspective in this regard. And as I have already introduced myself, this is Dr. Sobia Faisal. I did MPH from University of Texas from 2010 to 12. Before that and after that, I'm working in Pakistan. Right now, I'm working as technical consultant to CDC Pakistan. So let me bridge USEFP efforts and the CDC Pakistan efforts for public health. USEFP Pakistan has developed develop public health professionals for Pakistan, like working in Pakistan and supporting Pakistan health system. And we all are examples of that. CDC Pakistan, my experience with CDC Pakistan is like whatever standards I have learned in US, how should public health works, how should public health work? I have learned those things at US, but while working at with CDC, I have got an opportunity to see my country up to that level, up to that standards, which should be done in Pakistan. So I'm just giving you an example that I'm working on databases from last 20 years. But right now, working with CDC, I have got an opportunity to see at the data in a way that we can do a meaningful analysis for strategic directions. So this is a great opportunity for me, and I believe that the USAFP effort in developing such a platform where we can share our ideas and we can learn from our experience and from the international colleagues and SMEs who are working across the world on the similar issues. We will have a great time, and I hope that through this group, we all will be able to have a shared experience and shared learning. Thank you so much for giving me this opportunity to be a part of this excellent group. Thank you.
Great, thank you so much. We really appreciate it, Dr. Faisal. And thank you so much to all of our colleagues here in the CDC for their introductions. Next, I'd like to introduce you to Dr. Kamran Ajab, who will be sharing with us a little bit more about the public health work that the U.S. Agency for International Development, or USAID, is doing here in Pakistan. Over to you, Dr. Kamran Ajab.
Thank you very much. So we have got a small presentation which I'll be projecting in a few seconds, and then I'll be going through that presentation, and we are going to present to you our work over here as part of the health office. So can you see my screen?
Good. Yep.
Okay. So yeah. Okay. So moving forward, when we speak about our team, so we are honored to have a well-qualified team of foreign service nationals, and we have got a collective experience of 158 years among us. We have got 5 doctors and 6 development professionals with the graduate training in public health. And in addition to this, we have got a main team in Islamabad, and we have got our colleagues working at the Lahore, Karachi, as well as the Peshawar offices as well. And we are also drawing strong support from our local offices of acquisition and assistance, the executive office, the financial management, and the other office colleagues. So moving forward. So when we speak about Pakistan, so what are the major issues which are there that we are facing over there? So the demographic health survey, it highlighted the meaningful impact of the recent investments which were made by the USAID and the government of Pakistan for the maternal and child health and the family planning services. It also speaks about some opportunities for further growth, and it also provides the guidelines for future investment and concentration in the areas where there is no improvement since the last demographic health survey, which happened in 2012 and 13. So this survey, which was done in 2017, it illustrates that while we have made progress in areas like maternal health, the vaccination rates, but there are other areas which are still lagging behind. And these areas are basically a mixture of different elements. Like, for example, we are still lagging behind in terms of our family planning, commodity utilization. We are also marred by malnutrition at one end. Similarly, we have got the problem of the poor governance at the different levels of the health system. So these are the things which sort of hinder our progress towards the achievement of our goals. So moving forward, our current work involves in May 2019, the White House issued the U.S. Global Health Security Strategy, which articulates the USAID's approach to accelerate the capacities of the targeted countries, including, of course, Pakistan. And many of our activities in our health portfolio, they fall under this special objective with the aim to strengthen the global health security agenda. Dr. Christie has already alluded to that during her talk. And our focus mainly is on the prevention, the detection, and the response to the human and animal infectious disease threats. They are whether they are occurring naturally or accidentally, or they are started. And for that, Pakistan is a priority country because of the health status, the larger populations, and a growth rate which is very, very fast in the sense that we are adding more people every year. We have got the problem with the health infrastructure, which is pretty weak. And in addition to this, we are also facing certain issues pertaining to the infectious diseases, which have got the potential of crossing the transnational borders as well. Like, for example, polio, and the other good example is basically the drug-resistant typhoid infection that we faced in 2018. And you can see that in polio, we are still facing, there are only two countries left in the world, which is Afghanistan and Pakistan. So moving on, when we speak about our partnership in addressing the critical issues, so the areas that we are addressing are the lives of mothers and children. We are into the immunization. We are into the polio eradication program. We are advancing the global health security agenda. And in addition to that, we are also probing and also strengthening the not only the detection, but also appropriate response to the infectious disease. And the current most example is the COVID-19 epidemic that we are currently facing. When it comes to the lives of mothers and children, so these are our contributions over the years. And basically, we are working at the health system level with the aim to enable the health system to provide these services. So in that sense, our work is more at the primary and the secondary healthcare level as compared to the tertiary level. So moving on, when it comes to the immunization of the children, so USAID has already contributed 10 million to the World Bank-led multi-donor funded project, and this project is actually looking after the immunization and the disbursement of the finances is actually dependent upon the indicators which are linked with it. And that is our way of looking at the progress and also enhancing the spread of immunization for the whole of the country. And this is, we are talking about polio. So our work with polio involved our work through the WHO, where we are heavily involved in the surveillance of the polio disease. And that basically looks at the environmental samples plus also the identification of the virus and its genotype if there is an infection. And so we had a very good year up till now for this particular year, because up till now we have only got one wild polio virus case in the whole of the country, whereas previously last year, because of the COVID and because of certain other reasons, we got something like 84 cases. So moving on, when we speak about the strengthening, so we speak about the resilience of the systems also, and that basically was in the context of the devolution, which happened in 2011, whereby the domains of education and health, they were devolved to the provinces, with the result that there was no entity left at the federal level to sort of coordinate the health-related activities, not only internally with the provinces, but also externally towards the external donors and, of course, the United Nations agencies also. So we, for that particular method, our work then got divided into two areas where we are not only supporting the federal level, but we have also diverted our attention towards the provincial and more importantly towards the lower level as compared to the question that's basically the district level, because we see that the district levels are the levels where if we have got strong governance and the people know how to deal with related issues over there, so that would be very helpful in producing the evidence for a budget allocation for that particular area. So we are doing that. In addition to this, what we did was that we are also looking at different aspects of the logistical management of all the medicine or the medicines which are required all over the country. And we have got a robust system which is available at the federal level, and that looks into the rates of stockouts and other things for all these essential medicines which are being defined at the federal level as well as the provincial level by each province according to their need and their utilization. Similarly, we are also working on the contraceptions and the vaccines in all the areas. Plus, we are also working on the decision making at the district level by strengthening their ability to develop the budgeting at the district level according to their needs, and how that budget can be translated at the provincial level and gets itself funded in the provincial level budgets over there. And these are our attempts to enhance the governance and the transparency. So moving on, we also did some major work in the sense that we constructed gynecology and obstetric wards in Jinnah postgraduate medical center in Karachi. Similarly, we built a 133-bedded Jacob hospital where there was none. And we also did the renovation and equipping of public health facilities in Sindh. We developed the main contraceptive warehouse in Karachi, and from there, all the contraceptives which are coming into the country are then distributed all over the country. Plus, we, since Khyber Pakhtunkhwa is a priority area, so we are working at the district level in Khyber Pakhtunkhwa, where we are strengthening the health facilities with not only the equipment, but also the capacity building measures, so that the health workers are able to provide services more efficiently for the people. So moving on, this slide basically shows our response to the COVID-19 pandemic. And there was a donation of 200 ventilators at the beginning of the pandemic last year by the United States government. So what we did was that we not only got those ventilators, but in addition to providing those ventilators at the 64 facilities across the nation, we also went into an extensive training program where we trained people not only on the handling of those machines, but we also trained the people on the intensive care and the respiratory case management of the cases which are in the hospital. And we trained something like over 700 people on that particular issue. And these trainings are still going on depending upon the request from that particular province. When it comes to the detection and surveillance, so what we have done is that we are improving, we have already done that, and we are also improving the disease monitoring, the case tracking in all the districts of Pakistan. We are also into the infection prevention and control and the patient care trainings, plus also the care of mild cases within the house through our community-based health workers, like the lady health workers. So we have established 155 districts units in all 155 districts of Pakistan, and we trained over 3,000 people as part of the rapid response teams, which are housed within these district units to respond to the for tracing of the contacts and the patients for the COVID-19 primarily, and of course for the other infectious diseases also. And the work of our team is, basically this team comprises of different people, where the administrative people, plus all the people who are dealing with the patients, they come together as a mixture. In addition to this, for the current COVID-19 response, these are certain things that we developed at the beginning of the pandemic last year. Like, for example, we developed a traveler surveillance MIS, and that became implemented at all the 19 port of entries within Pakistan. And I think something like over 5 million people utilize this particular thing. Similarly, we also created a logistical management information system for these personal protective equipment for COVID-19. And we also developed a personal protective equipment calculator for the health facilities, so that we can always come up in advance for the requirements. Similarly, at the federal level, we are working with the Drug Regulatory Authority of Pakistan, and for them we have already developed an integrated information system over there. And from now onwards, the registration of any new drug by any pharmaceutical company can be achieved through an online portal. and the process will start from there. So this also cuts down on the time which was required for this. Plus, we are also assisting the private sector pharmaceutical companies in gaining the pre-qualification status from the World Health Organization, and that actually opens up a window for earning some export money on that basis also. So this is all from our side, and we hope that this presentation has given you a sense of our achievements and the impacts, as well as the areas where we are working and we continue to work over there. Thank you very much for your attention. And we are ready for the questions whenever the participants feel about it. So I will just continue sharing my screen. Thank you.
Great, thank you so very much. We really appreciate that. Thank you so much to our colleagues in USAID. We really appreciate that overview, and hopefully that's beneficial and helpful to all of you as well. Finally, we have one more colleague to introduce you to. I'd like to introduce you to a colleague who works in the economic section here in the embassy, Mike Berenson. He also works on the public health portfolio. So over to you, Mike.
Hi, and good afternoon, everyone. And it's really great to be hearing from everyone and learning about you all. So my name is Mike Berenson. I cover a wide range of issues to include health, along with environmental issues, climate change, technology, and other things. And then it's kind of a broad portfolio, but a lot of times people ask, what does public health, health have to do with the economy? And as I'm sure you all know, it has everything to do with the economy. And just the other day, I was doing a little bit of research on some of the climate change challenges in Pakistan and in many other places around the world. And these issues are so interconnected and not just complicated, but complex. And so what Anum Masood do, and Anum's on this call, and she works with me on this portfolio, is we look at all of these complex health and climate and environmental problems and try to figure out what it all means and how the United States can better, how we can help solve a lot of these problems. And the thing with public health and global health is that just like climate change, it is a problem for all of us to solve, because it is a global problem, and the COVID-19 pandemic is a perfect example of why we need people like Dr. Reed from our CDC, our USAID colleagues, and all of you on this call to help solve these problems that don't have borders. It only takes one infectious disease to get into the population and have devastating results. And in order to have strong economies, we need healthy people and healthy workers. So getting back to the relationship between all the many things Anum and I cover is, you look at climate change in Pakistan, you look at rising temperatures, you look at water scarcity, you look at pollution, whether that's water pollution or air pollution, and all these things exacerbate, and they all make the other worse. And when you look at the water situation in Pakistan, on one hand, you have glaciers melting, you have more monsoons, you have more flooding, can contaminate water supplies, that can lead to pollution and other things seeping into the water supply. But then outside of monsoon season, then you have water scarcity issues, and Pakistan is losing the capacity to store water, and due to inefficient agricultural practices, much of the available water, about 90% of it, it's estimated, is going to agriculture. Meanwhile, you have, I think it's about 30% of Pakistanis don't have access to clean drinking water. And then, as a lot of you know on this call, that leads to malnutrition and stunting, and all these just really complicated issues. And now with the Biden administration, global health is really really kind of been elevated. Global health and climate change as being top priorities, and the COVID-19 pandemic being one of the highest priorities from a health standpoint, but also these other long-standing issues like endemic polio and other diseases. So I'll end there and cede the rest of the time for any other questions or feedback from the crowd. Please don't hesitate to contact Alumni if you ever want to talk more about these issues. So thank you.
Excellent, great. Thank you so much, Mike. We appreciate you also being here with us today. And thank you to all of our colleagues who are here. So for the remaining time today, we have about 25 more minutes. We wanted to share with you why we're establishing this group and what we hope to achieve. First, we want to talk about the purpose. So our purpose with you being here today is to bring together like-minded alumni professionals dedicated to the field of public health issues, hopefully to best inform us of these issues, your challenges, and successes in your fields out, field on the ground. And there's another purpose, which is to connect. So this group is also about making connections, networking, providing opportunities that will serve all of us. Our colleagues who cover portfolios in the fields of public health in Pakistan would love to continue building their networks so that when exchange opportunities resume in the future, we have great recommendations from you all on who to include. And we also hope to be able eventually to hold in-person events and continuing with virtual events such as panels, speaker series, conferences, you name it. And whenever that need arises, it's great that we already have a set established group dedicated to that field. We can also use this relationship to raise awareness of public health issues, but also to help us better understand how the United States can better partner with Pakistan on these issues, which are global in scale. So for the remaining time, we'd like to know, what are your goals? We want to hear from you. What are some of the achievements that you hope for this interest group? What are some things that we could partner in together? And most importantly, how would you propose that we focus this group? Seeing as today is just the kickoff and it's an introductory session, we wanted to turn it over to you. If you guys have any thoughts on how we could best form this group, you already heard from all of your colleagues on their specific fields and their focus and their backgrounds. So if anyone has any thoughts, feel free to unmute and we'll have a brainstorming session for the next 10 to 15 minutes. Over to you all. Thanks.
Thank you very much, Elizabeth. And again, this is Dr. Mohammad Usman Zahir. I come here from the veterinary preventive medicine perspective. It's great to see that we have alumni in this public health interest group from not only the dedicated medical sciences, but from all the allied disciplines, which shows that the overall vision of the US Embassy as well as the PUAN in having a very holistic approach to when it comes to addressing or discussing about the public health issues in Pakistan. Hearing to the people and our folks that it looks like we have people from different disciplines, and what we can, my suggestion would be that we can develop some smaller, within that, some smaller focus areas, say it's infectious diseases, or there are non-communicable, there are some chronic diseases and non-communicable diseases, as Christy was also mentioning that the CDC also started off with the infectious diseases, but then spread out to include the other diseases as well. So at this forum, we also have people who are from the infectious disease background, and as well as there are people who are here from a maternal and child health perspective, and then there are people from mental health perspective, and then from the economic aspects of the overall public health issues, and then the environmental health aspects. So considering that, I would suggest and bring this idea to the floor that if we can have some smaller smaller components to the group so that we can have more focused discussion in those groups. That's just my thought. Over. Thank you.
Yes, please go ahead, Dr. Faisal.
Thank you, Elizabeth. Thank you. Is Mike still online? Mike Brenton?
Yes, Mike is still with us.
Okay,
sir,
Mike, I want to share with you that what you see on my background is a painting based on climate change. Since you referred to it, you can only see part of it because it's a huge painting, 8 feet by 4 feet, or about 5 feet in width. And it was done during one of our art retreats that we started in 2016. And we have done 4 art retreats on art and climate change. This is a group to raise awareness about it in Pakistan and to advocate for it. And this painting has remained #1 on Google for a long time. And next week, as I'm also the president of the East-West Center Association in Pakistan in Islamabad chapter, we are launching a project for 25 countries. It's called Visual Dialogue on Climate Change. And it's a photographic competition. So I would love to share that with you. It might interest you. And do drop in sometime at the gallery whenever you have time, and do let me know, because we work on limited hours, and only I come here when there is something to be done. Mostly working from home, besides public health activities. And there was one doctor, young doctor, I think her name is Khadija. She wanted to join, she said she wants to join this group to have some feedback for her future. She's most welcome if she's interested to talk to me for any guidance. I carry the history of 40 years of public health in Pakistan. Thank you.
Wow, that's incredible. Thank you so very much for that. And yeah, definitely this is a great connection, because we don't live or work on, just silo issues. So I think that's a great connection between you and Mike Berenson right there. I saw that Dr. Rakshinda had her hand up. Over to you, Doctor.
Okay, thank you. I just want to actually remind and request that gender-based violence, sadly, is still a reality. And we should not forget that before pandemic, COVID was dominating our lives. Actually, this pandemic was there, still there. And no matter what we do, whether we are health development experts or development economists or health economists, or in any area of medicine and health or social development, gender should remain the common denominator. And intersectionality lenses may be applied. So this is like a request. And if I could be of any assistance, I would love to share my experience. And I have worked with disadvantaged communities. I have worked with legislators and policymakers in nearly all regions of Pakistan, besides working in South Asian countries. So this was, my request that I wanted to share with our colleagues and peers. Thank you.
That's fantastic. Thank you so much for that reminder and that background. And definitely, I think you guys would all be excellent connections that if we're doing a talk or something, a project in the embassy specifically, in the focal areas of one of your areas of expertise, I think this is a great group for us to tap into and hopefully connect you with the right opportunities as well. Does anybody else have anything else to say as far as what they hope to focus on or achieve using this group?
I would like to add something here, if I have the speaker.
Yes, please go for it.
Thank you very much. First of all, I'm sorry I joined late. I'm Dr. Jawad from WHO Sub-Office Balochistan. So I've worked across in different countries, but currently working in Balochistan is one of the toughest jobs I've ever done. It's not impossible, but every place, every province, every country has different dynamics. I need to, go towards some action-oriented things. I've been listening to all of the experts. Thank you very much. I've learned a lot, and I'm hopeful that from this group we'll learn further as well. Currently in our country, though so many public health interventions are happening, the first need currently that I feel is integration Our interventions are not integrated. For example, we have huge interventions in polio, we have huge interventions in EPI, we have interventions in environment, we have interventions in so many things. And as Dr. Rakshanda was saying, the COVID-19 pandemic has recently struck us. One of the, along with so many other problems it has created, one of it is impact on other health, public health interventions, the impact of COVID-19 on other public health interventions. For example, immunization. Let me just add a statistic of just one disease of rotaviral diarrhea. Rotaviral diarrhea, according to the last NNS survey by UNICEF, kills almost 56,000 children every year in Pakistan. Which can easily be prevented just by 2 drops of rotaviral vaccine. Unfortunately, COVID-19, when it came, it has impacted all other activities. We could not go out for outreach and so many other things. In addition, a perception has been built in Pakistan, different perceptions built up because of wrong information, false information, and different conspiracy theories that you see every other day against immunization or against different things. Unfortunately, now we do have service delivery available. We have vaccine available, but our coverage of vaccination across Pakistan is still very low. I would request everybody in this forum to come up with any suggestions where we can work on perception management initiatives on a smaller scale, or a greater scale, using social media, using any other platforms, that we can work on the perception of our communities to support science, to support immunization, to support vaccination. Currently, less than 2% of the population of Pakistan is vaccinated. We have enough vaccine. Currently, I'm sitting in Provincial EPI headquarters, and behind me is the cold room. We have enough vaccines available, but our coverage of that vaccination is still very slow. People are afraid of different conspiracy theories. That's why they're not coming up and lining up for the vaccinations. That's what we were thinking. Through this forum, of course, we all are contributing, and I am very hopeful that we'll do something positive. My biggest request or suggestion to this forum would be, let's start working on perception building of the people, so that at least they can utilize the services, at least those services which are available. Like we have immunization services available, we have different hospitalization services available, but because of their perception against this, against immunization, that something will happen if I had this vaccine, is affecting our vaccination coverages. So building community perceptions in favor of public health is what we need right now. I think so. Thank you.
Sorry, we have an alarm going off. I'm going to pass it to Azra. Sorry about the background noise.
Yeah. Hi, can you hear me?
Yes.
Okay, so I wanted to just thank you, Dr. Javed, for bringing this up. This is exactly what I wanted to talk about. And this is a real life situation that I will just quote to you. I work in a public health organization, essential services, a hospital actually. And out of roughly 3,000 immediate frontline healthcare workers, less than 20% are actually agreeing to be vaccinated. Although we've come up with such massive campaigns here in Karachi. And we've also had, I'm sorry, it's a carrot and stick policy on disciplinary action against people, especially frontline workers, nurses, paramedics, who are not getting vaccinated. So in this group, we've got academics, we've got researchers, we've got policymakers. I think like-minded people need to get together and think about devising schemes, mechanisms, social media out. I don't know what has been ages since I've gotten into academics and research, but something at the policy level to convince people to get out of this hesitancy of getting vaccinated. And it doesn't matter which vaccine it is. As long as you get your first dose and the second dose, or even a single dose of the vaccine that is available, that should be good enough. Maybe not for you, but people around you. It's basically a community disease. So maybe academics, researchers, writers, policymakers here can come up with devising a mechanism to actually come around with ways of campaigning, creating public advocacy and encouraging people to getting vaccinated. Thank you.
Excellent. Thank you so much. Anyone else want to share some thoughts or opinion as far as moving forward?
Yeah, this is Dr. Sobia Faisal again. I just wanted to discuss what is the way forward of this group, how this group will function. Do we have certain functional areas which we can prioritize for our discussion, and what would be the frequency of meetings and sessions, and how we can contribute in the way forward discussions within this group, and is there any plan for that you can share with us so that we can give our feedback on that? So that would be great. That's my comment. Thank you.
Great, thank you. Yeah, and that's a little bit about the purpose of meeting today, to hear from you all what your hopes are. This will be moving forward a regularly meeting group. We aim to meet hopefully at least once a month to touch base. Sometimes there might be embassy related events that we will invite you to. There might be a speaker series, there might be conferences, or any kind of an event that might be touching on the topics of public health. We might also ask some of you to partner with us and maybe provide some information for an audience. So there's definitely an opportunity to collaborate on both sides. And we'll also have opportunity to solicit more feedback as far as the focus. Since we're in the pandemic, we definitely wanted to have, we absolutely invited practitioners as well, but we wanted to focus very, very specifically on public health and public health policy, so that we can continue to do prevention work as well as raise awareness. So we're really interested in intersectionality between public health practices and policy making, and how we can help advocate and partner with you in that. I hope that answers your question a little bit, Dr. Faisal. Does anyone else have any final thoughts before we wrap up for today? If not, that's fine. I want to say I've been very excited to have met and learned so much from all of you today. And we thank you for your generosity of time and your commitment to this group. We will absolutely be in touch via email and the WhatsApp group. If you haven't been added yet to our WhatsApp group and you would like to, and that can be a very casual offline conversation where anything related to public health, a lot of people are sharing their projects or some research or perhaps local events that are peripherally related to this topic. Feel free to share and network there. You can contact whoever invited you to this, one of our alumni coordinators, whoever invited you. Please email them your WhatsApp if you'd like to be added to our WhatsApp group. So we'll be in touch via email and WhatsApp regarding the next steps. We hope to meet monthly, if not more. And if you have any specific ideas for programming, collaboration, or additional ways of mobilizing this group, please do let us know. This is, it's a new initiative. Today's just the kickoff, so it's just the beginning. And we're looking forward to continuing to work with all of you. Thank you all so much. It's so great to meet you all, and hope you have a great afternoon. See you soon. Bye-bye.
Thank you. Bye-bye.
Bye-bye.
Thank you.
Thank you. Bye.